Hi, good morning. This is Mehak Kaur. I'm student of Chronic Disease Management from section KAA, and today I'm going to present my topic, that is anticholinergic drugs. So talking about anticholinergics, these are the drugs that block the action of acetylcholine. It is a neurotransmitter in the body, and these drugs inhibit the action of acetylcholine on various organs and the tissues in the body, leading to the specific physiological responses. So now let's move forward to the types of anticholinergics. There are basically two types of anticholinergics depending upon the type of receptor they block. First one is antimuscarinics and second one is antinicotinics. Antimuscarinics are those that block muscarinic receptors and antinicotinics are those that block the nicotinic receptors in our body. So moving on to pharmacodynamics. Pharmacodynamics is defined as what a drug does to the body. So talking about anticholinergics, it affects the body by three different ways. First one is blocking the receptors present in the body. Second one is having effect on ANS, and third one is relaxing the smooth muscles. These anticholinergics work by competitively inhibiting the receptors. Those are muscarinic and nicotinic receptors. As a result, they block the action of acetylcholine, which is the chief chemical messenger controlling the functions of parasympathetic nervous system. So the functions of parasympathetic nervous system are reduced, thus dominating the effect of sympathetic nervous system, and the blockage of acetylcholine can ultimately result in decreased motility of smooth muscles, increased heart rate, and decreased secretions such as of exocrine gland. Moving further to the indications of anticholinergics, first one is Parkinson disease. Anticholinergics are used in Parkinson disease because they help in managing tremors and rigidity. Drug used is trihexyphenidone. Second is also used in managing motion sickness and nausea. Third one is used in respiratory conditions such as ipratropium bromide, used to treat COPD and asthma by relaxing airway muscles and reducing bronchospasm. Third one is gastrointestinal disorders. These anticholinergics are used to treat the symptoms of irritable bowel syndrome by reducing gastrointestinal spasm. Next is preoperative medications. It is used to reduce excessive salivation and respiratory secretions before the operation. And last but not the least is used in relief of overactive bladder because it helps in reducing the muscle contraction. So this is anticholinergics are useful in all these cases. Now moving further to pharmacokinetics of anticholinergics, these includes all the processes that how these drugs are absorbed, distributed, metabolized and excreted in the body. First one is absorption. Most anticholinergics are well absorbed when taken orally, but some of like scopolamine are available in the transdermal patches as well for better absorption. Second is distribution. Anticholinergics are distributed throughout the well and their effects are largely due to their ability to block muscarinic receptors wherever they are present, and many can cross the blood-brain barriers, leading to potential central nervous system effects. Talking about metabolism, these are metabolized in the liver by various enzymes, and the metabolism leads to variation in individual responses. Talking about excretion of anticholinergics, these are excreted well through kidneys via urine, and excretion is influenced by factors such as renal function and urine pH. Talking about the rationale for using anticholinergics in three different populations, basically the elderly, children and the psychiatric population. Firstly, we'll talk about elderly population when these drugs are used for overactive bowel syndrome. We need to have consideration for the side effects, potential drug interactions, and individual responses. And when these drugs are used for the children, we need to make adjustment in the drug dosage and monitor the growth as well. And when used for psychiatric patients, where these drugs are used to manage the extrapyramidal symptoms caused by antipsychotic medication, nurses need to balance side effects and manage potential drug interactions with complex psychiatric medication regimen. Moving further to the indication of anticholinergics in different diseases, the first one I'll discuss is chronic obstructive pulmonary disease, also known as COPD. The rationale for the uses of anticholinergics is because these relax airway smooth muscles, leading to bronchodilation and improved airflow in individuals with COPD. Most common drug or the medication that is used is ipratropium. The second disease I would discuss is irritable bowel syndrome or IBS. The rationale for use of anticholinergics is because these help in reducing the abdominal pain and the cramps, along with reducing the gastrointestinal spasm associated with irritable bowel syndromes, and the drug used is dicyclomine. The third one I will discuss here is Parkinson disease. Anticholinergics are also used in Parkinson disease like benzoprine because these help in managing the muscle rigidity and the tremors associated with Parkinson disease. Talking about the side effects and the adverse reaction, firstly we'll discuss the side effects that are dry mouth, blurred vision, constipation, urinary retention, cognitive impairment, dizziness, increased heart rate, dysphagia, agitation, GI upset, and hypersensitivity to light. And moving on to the adverse reaction caused by anticholinergics, these are severe allergic reaction, hallucination, delirium, seizures, heart arrhythmias, and respiratory distress and heat stroke. So, talking about the contraindications of acetylcholine, acetylcholines are basically contraindicated in various medical conditions because due to these drugs, the signs and symptoms are exacerbated. Some of the contraindications are, first one is glaucoma. Glaucoma is a syndrome which is characterized by increased intracranial pressure and that causes ultimately damage to the optic nerve. Since these drugs act by blocking muscarinic receptors, they also reduce the drainage of aqueous humor from eye. Thus, these drugs increase more intracranial pressure and worsen glaucoma. Second one contraindication is urinary retention. Urinary retention is a condition in which the individual has difficulty emptying the bladder, and these drugs like the anticholinergics act by relaxing the bladder muscle and inhibiting the voiding refluxes. So these can further worsen the urinary retention by further reducing the bladder contractibility. Last but not the least is myasthenia gravis. It is an autoimmune neuromuscular disorder that is characterized by muscle weakness and fatigue. It is caused due to lack of acetylcholine receptors at the neuromuscular junctions. Talking about anticholinergic drugs, these block the effects of acetylcholine, further impairing neuromuscular transmission and muscle function. Moving further to the role of nurse, nurses play an important role in administration of anticholinergics. The main model which they use is clinical judgment model, which has different steps. First one is it includes the recognition of cues, then is analyzing those cues and collecting more data, then is formulating a hypothesis that this condition, it basically includes that we may be considering the condition of the patient and relating it to certain triggers or certain diagnosis, nursing diagnosis. Then later on we'll be gathering more information about it, and last but not the least, it would be like evaluating the hypothesis and making a clinical decision based on whatever the information is collected. So, talking firstly about the role of nurse before administration of the drug, it includes the assessment of all the information about the patient, basically the history of the patient and the vital signs. Next is informed consent and medical reconciliations. Also includes monitoring the fluid level or the hydration of the patient, assessing the fall risk in the patient, Last but not the least, it includes the documentation and communication reassessment. Talking about the role of nurse after administration the drug, it is basically to monitor the status of the patient and assess the side effects, if any, present related to the drug that is administered prior. It also includes the role of nurse in managing the fluid administration and managing the risk of falls. It further The role of the nurse is also in pain management and documentation as well. Talking about the patient education, nurses play an important role in educating the patient and telling them that they know the role of the medication and why this medication is given to that patient, uh, and how do they manage or how do they know if this is a side effect and adverse effect. Nurses have an important role in educating the patient about the prescription of the drug and finishing the course. They must educate the patients regarding the common side effects, its management, inform all the healthcare providers about all the medications that is given to specific patient, and they must also follow precautions and be aware of contraindications. Nurses, it is the responsibilities of the nurses uh, to regularly give them instructions if they are in specific age group, and educate them to watch for cognitive effects, especially when driving. And it's the role of nurse that they should educate the patients about the storage of medication properly at home, because these medications should not be in the reach of the children or those vulnerable groups, and let them know that they have all the rights to ask a different question and no question is vague, that they should not be hesitant in asking any question, or they should be able to seek help when needed. Thank you so much. I hope you understand very well about anticholinergics, their mode of action, side effects, contraindications, special indication in special age groups, and role of nurse, and also what is the role of nurses in patient education as well. Thank you so much.